Hello, good morning, good evening, and good afternoon to everyone joining today's Ask WHO session with Dr. Mike Ryan and Dr. Maria Van Kerkhove. We have good news that you've been asking us many times, when will the global emergency of COVID-19 be over? So we brought to the world good news yesterday. So maybe we can start with that. Dr. Mike, Dr. Maria, as Dr. Tedros declared yesterday that COVID global health emergency is over, what does that practically mean?
It doesn't change anything what we're going to be doing here with COVID and with other infectious diseases, but it's an important signal. It's a moment in time when we believe that the emergency phase of the pandemic is over. In other words, that global public health emergency, that need to operate together in a sort of an acute response mode, and continuing to fight to improve surveillance, to improve our response, to improve clinical care, to develop the vaccines, to develop the antivirals, that acute phase is over. And we need to move now to a more sustained response, to a more sustained preparedness, and more sustained action, because COVID has not gone away. COVID has not ended, and COVID still represents a major challenge and a major risk for especially those vulnerable people out there. So it's a shift of gear. It will allow our member states to also shift their gear from a purely emergency response mode into a more sustainable long-term mode of operation. It will allow us to integrate a lot of the work we're doing on SARS-CoV-2, to integrate that with influenza, to integrate that with other emerging diseases, and to really develop the more long-term strategic approach to preparing for and responding to these pandemic viruses. So in that sense, nothing. It's like a phase change. It's like moving the seasons. On February the 1st. Maybe the official start of spring, but it doesn't always work out that way. So we're still in a transition phase, and we're going to have to maintain our vigilance. Maria can speak to those uncertainties that we still face, but it is a moment as well to stand back and to reflect on what everyone out there has managed to achieve over the last 3 years or more. We've been through the biggest health crisis in 2 generations, in a century. We've really experienced the vulnerabilities that have come with the large population distributed around the world, and what a virus can do to our health systems, what it can do to our communities, what it can do to our economies. We've experienced all that, but we've also experienced tremendous solidarity and ingenuity and huge resilience out there in communities, the bravery and courage of our frontline workers, especially our health workers, and the triumph of science that can bring vaccines, bring drugs, bring new solutions, diagnostics in record time. However, we also have to reflect on some of the inequity and the unfairness that occurred in the process of distributing those vital drugs and vital vaccines to the world. So a lot of lessons learned. The question now is whether we can actually apply those lessons going forward to continue controlling COVID, and can we take those lessons and apply them to other epidemic threats that we face, so we can be better prepared the next time. So no, nothing really changes from day to day, but we have transitioned to a more evolved way of looking at this virus, and looking at this virus in the context of all the other threats we face, and building long-term, sustainable, scalable systems to fight this virus and other viruses in future.
Thank you so much, Mike. And Maria, your thoughts?
Yeah, I agree with everything Mike has said. I mean, it's a hugely important moment. As Mike says, in terms of what we're doing, we will continue on, and in many respects sort of propel us forward to make sure that we focus our efforts on what really needs to be maintained and sustained. The moment it's a long time in the making moment. It's not, as DG said yesterday, a snap decision that one day you're in an emergency and the next day You're not. We've been working towards this for quite some time. And so the crisis phase of COVID-19, the emergency phase of COVID-19 is over, but COVID is here to stay. And it is hugely important because on one side, we should think of this as a celebratory moment and the accomplishments that everyone around the world, every country, every person on the planet has worked towards achieving. On the other, there's so much more that we need to continue to do. And I've been looking at the media overnight. I've been looking at social media, and I hear a lot of, but wait a minute, what about vulnerable populations? What about older populations? What about people who don't have access? And this moment doesn't mean we forget about you or that we stop. And what was said yesterday in the statement of the emergency committee members, but also in the statement of the Director General of the World Health Organization, is that the worst thing to do right now is to stop. That is not what this means. It means we ensure that everything we're doing for COVID becomes more sustainable, that we focus our efforts on vulnerable populations, people at risk for developing severe disease. And whatever we're talking about, whether it's surveillance, we make sure that we are tracking the virus so that we understand the variants that are circulating and what that means. We make sure that when we look at vaccination, that we are prioritizing reaching target populations in people over 60 in every single country, because every single country, including high-income countries, has gaps, but especially in low-income countries. We make sure that patients that need care get into the clinical care pathway as soon as possible. That means better diagnostics and use quickly, access to antivirals, and making sure that the clinical care pathways are much more solid going forward because COVID is here to stay. So we don't want COVID to be treated as an emergency in individual systems. It needs to be integrated into longer term systems because that's what makes it sustainable. So that's what we've shifted. And in fact, even before this announcement came yesterday, on Friday, WHO issued on Wednesday an updated 2-year strategy actually outlining what needs to be done to reduce infections, to prevent infections in the first place, because we haven't abandoned that activity while you live your lives, taking steps to prevent yourself from getting infected, but also to reduce the impact, the hospitalizations, post-COVID-19 condition. But also a third objective is for us as WHO, through our regional offices, country offices, and here in HQ, support countries in transitioning from crisis to sustained integrated disease management. All of that has been happening for quite some time, but I do think it's a really important moment to reach. I'm conflicted on my own. I've been really emotional over the last couple of days because we've worked so hard, but I can't forget, the people who are still dying right now, and think we could do more and think we should do more. So that's the conflict of that for me anyway. But a positive moment. A respectful reflection, but we have not forgotten about vulnerable individuals. And I want people to hear that out there because I do see a lot of that. Well, hang on a second, what about me? And I don't want there to be any impression that we will stop work, that WHO will stop work and will stop fighting against this virus.
Thank you to both of you for setting the scene for today's conversation. We're already receiving questions from the viewers who have been with us, I assume, as they already know how to do it. But for those maybe who are joining first time, I'm just going to remind you, if you want to send us your question and you're watching us on Twitter, please use the hashtag AskWHO. If you're watching us on other platforms, you can use the comment section, and my colleagues behind the scenes will pass your questions to me, and I'll pass them to Mike and Maria. And for those who have already sent them their questions, Mohammed Adam, who is watching us on Facebook, Mike, as you said, this is a new season, and new. That's how you mentioned in your first answer. So I think this is a follow-up question. So is COVID-19 now seasonal?
That's a great question. No, I don't. I think it's periodic or episodic in the sense that it is coming in waves. Those waves are as much driven by the emergence of new variants as they are by the season. So if you have a stable virus, let's say the virus is stable, then what causes the virus to transmit more is very much environmental. So the same virus will transmit more efficiently at different times of the year. That's what often brings in seasonality. Where people crowd together, they're inside more in winter. That's why we see influenza in the northern hemisphere. It's not that the viruses themselves are more transmissible, it's the environment, the circumstances and the conditions for transmission go up. COVID is a very similar pattern in that it will transmit more efficiently in situations where people are crowded close together. But the virus itself is also evolving rapidly. And therefore, when a new variant or a subvariant emerges that has a transmission advantage, it will cause a wave of infection regardless of the season. So the virus has some seasonal qualities, but it has not settled down into a seasonal pattern. So I would say it's a mixed seasonal and sort of episodic type of transmission, and I don't know if that's going to settle completely into a seasonal pattern. This virus still has a lot of kinetic energy, a lot of variability, and that's why it's not settling into that pattern that we might expect. But I would predict, for example, in the Northern Hemisphere, that we will consistently see higher activity of the same virus in winter. But it could easily be that a new variant could emerge in Europe in the middle of the summer, or emerge in the Southern Hemisphere in the middle of the summer and cause a lot of transmission. So I think it's going to be some time yet before we see a very predictable seasonal pattern.
I think that's right, and I think that's one of the biggest challenges that we face going forward is that we don't have that predictability. It is driven, the transmission right now is driven by the emergence of these subvariants, these Omicron subvariants, and there's probably more than 1,000 subvariants now that are in circulation because Omicron's been in circulation for more than a year now. And each of these waves that we're seeing, I was trying to describe it yesterday. I don't know if I did it very effectively, but if you think of this like, earthquakes and aftershocks, it's not the same thing, but we've had these massive peaks of activity, that were driven by the original emergence of the ancestral strain. And then we had Alpha, we had Delta, we had Beta, we had Gamma. And then since November of 2021, we've had Omicron. And the subvariants are very similar to each other, more than 1,000 of them. And they're causing smaller aftershocks, meaning we're seeing waves of infection, but they're not as high in terms of peak because we have population level immunity. And that is from people getting infected or reinfected or vaccination or a combination of both. And that immunity that people have is preventing people from getting severe disease, but immunity wanes for infection after a few months, up to 6 months or so. And so we will continue to see people get reinfected, but the impact is what's changing. And as Mike said, there are other factors that drive what we see in seasonality, like we do for influenza, where we see in northern hemisphere temperate regions in the winter season, and the southern hemisphere in the southern hemisphere temperate regions, you see a predictable pattern. We don't yet have that for SARS-CoV-2. And one of the things that the emergency committee was considering and what WHO was considering is this predictability. We don't have that yet, but we could see that coming forward. So it's keeping us on our toes, and this virus takes advantage of any opportunity it can to really spread, especially in indoor and enclosed settings where you have poor ventilation, and it builds up because this virus passes through the air between people. And it will take advantage of that.
Thank you. I think we have a very good follow-up questions, and I would like for you to clarify the difference when we communicate that we are ending global health emergency, because the question comes from Ernesto Gatto. Why WHO ends COVID pandemic yet if some countries are still experiencing cases? And then there was also a question from someone watching us on Twitter, wondering if pandemic is over is right messaging. Lots of people are sick again. So I think it's very important that we clarify the difference.
Yeah. I mean, the virus is here with us to stay. SARS-CoV-2 is circulating in every country right now. We're in the 4th year of this pandemic. And the announcement yesterday was talking about the crisis phase, the emergency phase of the pandemic, of COVID-19. But COVID-19 has not gone away. What the DG said yesterday was that the emergency phase is over, but COVID is not. So that's what we are dealing with right now. We're better at managing COVID-19, but as the viewers have pointed out, people are getting infected, which is why we have to keep up our efforts to reduce transmission. We have to keep up our efforts to ensure that people who do get infected get the right clinical care so that they don't die. We have to make sure that people who are required or recommended to get additional doses of vaccine receive those, and that countries, all people everywhere, have access to antivirals. And we can't forget about the basics. You know, that the wearing of a mask where appropriate when you're in a really crowded situation and you know the virus is circulating, especially if you're in a category of being at risk for developing severe disease or dying. So people who are over 60, people who have underlying conditions, immunocompromised individuals. We've said, you know, for the last 3.5 years, it's the do it all, but it's not do it all at once. We are living with this virus. We're still learning to live with it, and we're getting better at it. But that's what we mean by being vigilant. So the threat is not gone, but it's not the same as where we were 3.5 years ago. So the step that we took yesterday, that the DG took yesterday, acknowledges that the emergency part is over, but COVID is not. So the message to think that this is all over is not the message we want to convey. However, we do recognize that individuals that are out there are living their lives. They're living their lives as safely as possible, and they're going about their business. We need governments to not drop the ball and make sure that governments retain the systems in place for surveillance, for clinical care, for genetic sequencing, for infection prevention and control, all of the elements of community protection, risk communication, community engagement, infodemic management, all of the different activities governments need to focus on, so that they can monitor the changes and scale up and scale down as necessary.
Thank you, Maria. I think you said this virus is here to stay, but we got a question whether is it possibility of ever eradicating COVID completely?
No, I don't believe so. There are very specific criteria for when you can eliminate or eradicate a virus. We've only ever done it once on this planet, and that was with smallpox. We're close with wild polio virus, very close, and it's something very close to my heart and very dear to my heart. But in general, if you want to eradicate, eradication is a term that's used for the complete eradication all around the planet. Elimination is often used when you want to get rid of a virus or an infection in a particular area, or you want to reduce it to such a low level of transmission that it doesn't do any harm to public. Generally speaking, those viruses that you can eradicate or eliminate are viruses that uniquely only infect humans, and for which you can generate broad-based population immunity, and where you have excellent surveillance. What we see here is a virus that evolves quickly. It can move from humans into animals, from animals into humans, so it can hide in different spaces in our ecosystem, not just in humans. When the virus is only in humans, you've got one target. But when the virus can move easily back and forth across the species, it's very hard, very, very hard to think about elimination or eradication. But can we eliminate the public health threat associated with the virus? Yes, we can. We are doing it through vaccination. We're doing that through treatment. So that, I think that's the difference. Even when we talked about the termination of the public health emergency, we're able to say we can end the emergency, but we can't end the virus. And the history of pandemics is very much that the pandemic viruses or the pandemic strains that cause pandemics generally stay around in the system, in the human system, for years, decades sometimes afterwards. And it's like one of those, the way you have waves on the wave. You throw a stone into the water, you see a big wave. And eventually, after a while, the waves get smaller and smaller and smaller. And even 10 minutes later, if you look, there are tiny waves off in the distance, tiny ripples. You don't call them waves anymore. And if someone came and looked at the water, they wouldn't know that was necessarily a stone that was thrown in the water. But those reverberations, those echoes of the original stay in the system, and they just ripple through. And very often it's the emergence of a new pandemic virus that sort of ends the previous virus because it gets competed out. So in influenza, classically, for example, today, one of the most prominent circulating strains of the influenza virus is H1N1, which is the virus that caused the pandemic in 2009. And God forbid we get a new pandemic, it would be replaced. So the real question is, can we eliminate the public health threat associated with the virus? And the answer is yes. Can we eliminate the virus? I think the answer is very unlikely, if not impossible.
No, I agree with that. I think what we are planning for is the virus is here to stay, and we have to manage it better. and we have to continue to reduce the impact, reduce the threat. And we can do that. I mean, it's pretty miraculous that we have so many tools that actually are effective against SARS-CoV-2. And most people talk about the vaccines, and that's an incredibly important one. We have so many safe and effective vaccines that have saved countless lives. I don't even know what the latest estimate is of how many lives have been saved from vaccination. We could have saved more, for sure. But we also have personal protective equipment. We have antivirals. We have other therapeutics that are preventing people from developing severe disease and dying if they get infected. And there's other things that we can do in terms of preventing the infection themselves and improving the ventilation where we work, where we study, where we, go to school. All of that needs to be invested in, because the other thing we are constantly working on is pandemic prevention and preparedness. We're responding to COVID-19 right now as this emergency. And yesterday, the DG declared the end of the emergency phase, but we're still dealing with COVID. Everything we're putting in place for COVID will be beneficial for flu. And don't forget, we didn't start working on infectious diseases on January 2020 because we were working on influenza, we were working on MERS coronavirus, we were working on polio and Ebola and HIV and malaria, and all of that was beneficial for COVID. So we can't lose the momentum. The other message DG had yesterday was we cannot lose the gains that have been made in the last 3.5 years. We have to keep pushing on those for COVID, but also use these gains for the future. We are going to be faced with other threats. We are being faced with other threats right now. And that is the promise going forward. You heard Mike talk very passionately yesterday, and DG talk very passionately yesterday about the pandemic accord and the promise for the future. And doing what we're doing now for COVID, all of us, will have an impact on that next one.
Thank you, Maria. And we have a lot of questions coming. I will take the next one from Mohit Saini, I think watching us on LinkedIn. How many variants in total were recorded during the pandemic? Which strain costed the most number of lives?
Oh my gosh, that's a really fantastic question, and I don't know the answer to that. Because it's dependent upon the sequencing that's done around the world. Right now, we have more than 1,000 subvariants of Omicron. And I'm looking at, we gave this big presentation the other day, and oh my goodness, there are millions of sequences that have been shared with, just say, that doesn't mean millions of different viruses. I'll have to come back to you on that. I'll post that to the team and see what we can find. We've had pretty massive waves of infection. We had the ancestral strain. We had big waves of Alpha, very big wave of Delta. And then since November 2021, we've had Omicron. Now, the amount of circulation of Omicron was so much more transmissible than the other variants of concern. So we had huge numbers of cases that were reported. And if you remember, even in our epicurve, we had to rescale the epicurve because the axes were too small. We had, I think, 23 million cases reported in 1 week at one point. I could be wrong on that. I'll double check. But I think in the Omicron wave, because it's been so long, we've had, I think, more deaths during Omicron than during Delta because it was such a sharp peak up and down. But I'll have to come back to you on that because that's a really fantastic question. But we don't have 100% accurate data. We don't know all of the infections that are out there. We have cases that are reported to us through official reporting systems. And even the deaths, there have been about 7 million deaths reported to WHO, but we know that number is about 3 times higher. That's estimated to be 3 times higher because we don't know. So it's very difficult to answer that question. And there are different levels of surveillance. There's different levels of reporting in countries, high-income countries, low-income countries across different continents. So it's very difficult to know an accurate representation of that. What we can say is to date that we've had more than 6.9 million people who have died from COVID-19, and that number is probably at least 3 times higher.
Thank you so much, Maria. We have a question from Melissa Hohenberger. Are we still telling individuals to isolate if testing positive?
Well, I'll give you my own personal view on that. If I test positive, I would isolate myself purely to prevent my family getting the disease or prevent anyone vulnerable in my family or risk exposing my co-workers at work. So yes, governments will have different advice. on whether you should be tested if you're symptomatic. But my view is if you're symptomatic and tested and you test positive, then you should refrain from contact with other individuals until you're negative. I wouldn't change that advice, but I would say the same thing, to be quite frank. If you've got severe influenza, you should be doing the same thing. So if you've got a severe respiratory tract infection, the prudent thing to do is to try and not pass that on to someone else. And if possible, and it's not possible for everyone. Many people on this planet have got to work, and if they don't work, they don't eat. So sometimes it's a first world problem, you know. But if you're in a position where you're able to do that, and if you tested positive, and you're not going to suffer physically from doing that, or your family is not going to suffer for that, then yes, I would advise people to isolate. But I would say the same as I said with influenza or any other severe respiratory infection.
Yeah, and there's a difference between guidance and policy. So our guidance still recommends people who are infected to isolate for the objective to prevent passing the virus on to someone else. But the policies that are set in country about isolating if you're a case, vary. And they vary for different reasons. Some because of vaccination coverage, some because of the ability to pay people to stay at home if they are unwell. And so we set the guidance before what the data tells us, how long one would need to isolate with the objective of preventing onward infection. But again, as individuals, we do the same thing. People ask, should you do self-testing? We are so fortunate that we have access to self-tests. We have a bunch of them at home in my own family. We'll do a self-test if we have people over, just as a precaution. And that's a privilege that we have, but that's a change. Can I go back to the other question real quick? Because I checked the data. In our epi curve, I did say one of the highest peaks we had was in Omicron, and we had 23 million cases, but we actually had a large Omicron wave, and that was 23 million cases, around 23 million cases reported in January 2022. But this past December, we had this large Omicron wave in China. And in 1 week, we had 44 million cases reported, and that was just this past December. So it's very dynamic. The situation is very, very dynamic, driven by these variants, driven by all of these other things that are in place. So I just wanted to clarify that.
Thank you so much. Next question. I actually received quite a lot of questions in regards to vaccination. Mm-hmm. So if the emergency state of COVID-19 has come to an end, however, can the WHO state what the course of vaccine will be going forward? Do we need to take vaccines regularly? And whether this change of emergency status will have any effect on vaccination efforts in different countries?
I think countries have already been adjusting their vaccination policies over the last year or more. And WHO is working through our SAGE process, the Scientific Advisory Group on Immunization, as well as our TAG COVAC group, at what the advice would be for the long-term composition of vaccines, and then what the policies WHO advises regarding their utilization at national level. But again, each country has different profile, different age profile, different vulnerability profiles, different economic profiles. So each country sets its own policies, but very often looks to the global policies as advised by WHO. There's no question in my mind that people with vulnerable underlying conditions, older persons and others, we need to first make sure that those people who haven't been vaccinated get vaccinated. I think that's the key. And where governments advise a booster, particularly for vulnerable people or older persons, then our advice would be to get that vaccine. But the adult vaccination has always been a challenge. We need to mainstream adult vaccination with influenza and other vaccines that are offered, and be able to offer those vaccines at the right time to people in the right situation, because I don't think we're going to be in a position where we can have special clinics anymore to do this. Again, vaccination needs to be integrated into the primary healthcare pathway, so it's family physicians and others giving those vaccines, or local public health centres. So when a person goes to have their influenza vaccine, they might also be getting a vaccine against COVID. So that mainstream is already happening. I think many people out there will know that their last booster may actually not have been delivered in a big clinic, but it may have been delivered by the local practitioner or public health nurse. So that is happening. A lot will depend on how the virus evolves, but I think what is clear, that even as the virus has evolved and it's shifted genetically, the fact remains that if you've had a primary course, a full course of vaccines with the ancestral strain, you still retain a lot of protection. There is a waning of immunity over time, but with a combination of vaccination, natural infection, and boosters and others, what happens is that the immune system matures in its response, and you get a broader-based immune response that lasts for longer. But there is a decay in that protection over time, and governments will individually set where they see the moment at which they would offer a booster to a specific group in the population. I don't see governments offering boosters to everyone in the population from now on. I think governments have probably made a decision that for the vast majority of people in a given population, if you've had a primary course with a booster or you've had a primary course, you're okay. But if you're in a vulnerable group, and again, governments define vulnerable groups slightly differently across the world, many governments are continuing to offer booster shots to people, particularly after a period of time where immunity may have waned. It doesn't mean that the people who don't get the booster have no protection. They still retain a high degree of protection against, certainly against hospitalization and death. But my advice would be to anyone out there in a vulnerable group, an older person, if you are offered a booster under a government support program, then I would take that. I would take that booster. But I think the good news is that those people who have received primary course or primary course with a boost, or a combination of that with natural infection, have a very high degree of protection against hospitalization or death.
Yeah, and I think that's right. But I think, what we're trying to focus on are those gaps. Where are we missing those people who have missed the primary series? And if we look at a global level, 82% of people over 60 years old have completed their primary vaccination. But if you actually look at that and a breakdown at low-income countries, it's only 27% in low-income countries. And boosting is at 3%. So there's huge pockets. And like Mike said, if you are offered a booster, if you are in an at-risk group, take that booster because it is showing significant protection against severe disease and death. And I think that's what we want. When we say minimize the impact, reduce the impact, it's really focusing on the individuals who are most at risk for developing that severe disease.
Maria, you entered the new question, the next question that I wanted to ask, coming from Sir Radoju Keita. What is the global immunization coverage? Are you satisfied with this rate? We know that some countries, especially in Africa, have not even reached 20% vaccination coverage. Are you sure that the situation is under control?
There were a lot of different questions in there. And are we satisfied with the vaccination coverage? I think the short answer to that is no. Which is why we're working so hard with countries to increase vaccination coverage, because the threat is not over, right? We keep saying this, the threat is still not over. So, our focus and SAGE's recommendations, the policies that we're asking governments to set are focusing on individuals over the age of 60. And if we look at booster coverage in low-income countries, it's at 3%. 3% of low-income countries. In low and middle-income countries, 27%. That's very low. And if you look at the individuals who would be at risk for needing a hospital bed, needing medical oxygen, needing intensive care, these are the individuals that need to be targeted for the vaccination campaigns in the longer term. The other part of your question was how many boosters will they need and how often will they need? We don't know the answer to that yet. That's why the data coming in to TAG COVAC, which is looking at vaccine composition at a global level, SAGE setting those policies, are constantly looking at data. They're looking at population level immunity. They're looking at how that wanes over time for infection, for symptomatic disease, for severe disease, for death, to make those recommendations. We know a hell of a lot more about SARS-CoV-2 and COVID-19, but we don't know everything yet. It's still relatively new, even though we feel like we've been dealing with this for quite a long time. We have a lot to learn, and this is a coronavirus, the first pandemic of a coronavirus. It's not the same as influenza. We learn a lot from influenza, but it's a different pathogen. So we have to respect that, if you will. and continue to learn and make recommendations as the data comes in.
And maybe I just add to that too, because again, governments are faced with a whole series of trade-offs right now. Government may look at their overall coverage and then look at coverage in vulnerable groups. They have to trade off. The vaccine is widely available now, but there is a fall off on demand for that vaccine from countries. So it's not that in this particular case that low-income countries can't get access to the vaccine. They can get access to the vaccine. The issue is, what are the trade-offs in that? If a government looks at seroprevalence and says, you know what, we have 95% seroprevalence in our population, how do we now go and boost our vulnerable population when we've got children dying of measles and our measles campaigns are take a priority, or getting our cancer services back on track is taking a priority, or there's so many others. Many countries are losing health workers who are migrating away for better opportunities elsewhere. How do we retain those workers? We need to pay them more, we need to train them more. So when a government looks at all of the different trade-offs, it's got to put vaccination against COVID and boosting for COVID in the context of the broader health threats, the broader economic threats. Our advice as WHO would be, yes, please, if you can, please vaccinate, fill those gaps if you can. We will help you fill those gaps. We will work with you. We will work through COVAX. We will work through issues around information, misinformation, hesitancy. We will work on the logistics with you. But we have to be guided by governments themselves, because they, as I said, are dealing with multiple issues post-COVID. They're dealing with the impact of the climate crisis. If you live in the Sahel or the Horn of Africa, southern Eastern Africa now, we have cholera outbreaks all over the place, which are really been driven by climate change, by drought, by flooding, by cyclones. Those governments, if you're in Mozambique or Malawi, cholera is a much bigger threat right now to your population. In many countries around the world, there are measles outbreaks, diphtheria outbreaks. So the effective collapse of childhood immunization in some places is a much larger threat to the health of the population right now. And that's part of this process. What we want governments to do is to think through their priorities, recognize when they do have a serious gap in immunity for COVID, and take the opportunity when they can. But they have to do that in the context of all the other health challenges that they have to address.
We get a lot of questions about this. We're not saying, as we sit here and we're talking about COVID, we're not saying deal with COVID at the expense of measles. We're not saying save someone's life to COVID so that 3 children will die of measles. It's the balance of making sure you do as much as you can for the entire population, balancing all of those risks. And so we've been focused, and the world has been focused so much on COVID, specifically in that first and second year. As we are transitioning the work of COVID, this is to make room for everything else. We can't do that at the expense of, like Mike just said, cancer treatments and measles and dealing with cholera, dealing with climate crisis. We have to do that in the context of everything else. And it is hard. The space, for people to work, the people who have to actually do this in country have not grown massively. It's just more challenges are placed upon them. And the decisions that governments have to make are incredibly difficult ones. We don't take that lightly. So what we're trying to do is optimize what can be done. If you have to focus your vaccination campaigns, focus those who are most at risk. We call these opportunity costs. We don't want to put so much effort on COVID at the expense of people dying for other diseases. We have to get that balance right and save as many people as we can, prevent these diseases as much as we can, because it is so much more cost effective to save someone's life so that they have a healthy, productive life than to treat them later on. So these are very difficult decisions that governments have to make.
Thank you very much. Still a lot of questions. And I'm trying that we touch on all different topics.
I think she's telling us to do shorter answers.
With the change of emergency status, we're receiving quite a few questions and comments from vulnerable populations. So what about the millions getting long COVID and all those people who are now immunocompromised and need to avoid reinfection?
This is what I was saying before. I'm seeing that as well. The decision that was made yesterday, the announcement that was made yesterday about ending the emergency phase does not mean we stop work. It does not mean that we stop doing everything that we can to prevent infection in vulnerable populations, to provide care for people who are infected, to study, to provide rehabilitation, to provide recognition to people who are suffering for post-COVID-19 condition. Our work is not done. We're here on a Saturday answering these questions because we don't stop. Maybe, the people that we work with at this organization, the thousands of people that we work with, have not stopped. And that will continue. And we need governments to keep up that level of effort to make sure that we don't forget everyone. And so it's a commitment. So I just want to be very clear that that has not stopped. It's just, again, talking about the emergency crisis phase of this. And now we are just going to keep at it to make sure that we do everything that we can to make sure we focus our work on vulnerable populations.
But your listener makes a valid point. There's always a danger in the transition that you take the foot completely off the pedal and you lose momentum in key areas. And when you're switching phase, it's like switching gears in a car for anyone who drives a stick shift. If you miss the gear, you end up stuck on the road. So I do think there's a valid concern there, and especially for people who are experiencing post-COVID condition. So everyone thinks it's over. It's not over for me, or it's not over for my partner. It's not over for my mother. It's not over for my father. Will they now forget us? Will they now move on? Nothing to see here. And I think that's a real concern. That's a genuine fear. And it's not a fear that is baseless, because the history of emergencies and others is the world does move on. It's very, very common the phenomenon that happens in bereavement, when you have a close family member and everyone mourns together in the family and the village and the broader community. But eventually, after a couple of weeks or a couple of days, everyone else moves on, but you're left with your core group of family still mourning, and you look around and you think, my God, they've all moved on, but we're still here. And I think a lot of people with post-COVID condition will be fearful today about that. All we can do from a position of the World Health Organization is to, and look at Dr. Tedros' speech yesterday, we're not going to stop. We're not going to stop surveying this virus. We're not going to stop trying to make better therapeutics. We're not going to stop trying to work with partners to make better vaccines. We're not going to stop working with post-COVID condition survivors and scientists and clinicians to understand post-COVID condition better, to develop better approaches to therapy and to rehabilitation and to recovery. We won't stop. And I think Tedros was clear yesterday, the world can't stop on these things. We need to integrate them into a broader mechanism to look at all pandemics, to look at all those threats we face together. And we have started, and it wasn't a snap decision. We have a health emergency preparedness, response and resilience strategy that's in place now with a whole lot of work going on the legal frameworks, the financing frameworks we need, the system frameworks we need to be able to protect communities, to be able to have safe, scalable clinical care, to improve collaborative surveillance, to get better access to countermeasures, and to keep going with good coordination and our ability to work together in collaboration and coordination. So we're bringing, if COVID has, COVID's done a lot of damage, but what it actually has done as well is that it's convinced everyone that we have to find a way to come at this problem in a more coordinated way, in a more cohesive way. We need to converge all our work. So those working on flu and those working on COVID and those working on broader health emergencies coming together to address these issues more comprehensively. We've got right now negotiations going on between our member states on a pandemic accord or an agreement, basically a legal agreement between all of the states of the world about how we're going to do this in future. We've created a pandemic fund working with the World Bank and other partners, which is going to provide dedicated funding to improve our health emergency preparedness and response. We're revising the international health regulations so that they're more fit for purpose, or the member states of our organization are revising them. And we're building a lot of systems. We're improving surveillance. You've seen the expansion in genomics. We've seen environmental surveillance being expanded. And as Maria said earlier, it's very important not only do we not lose the gains we've made. There are many countries. I was in Sierra Leone last week with assisting with a health and preparedness review with the government, and it was interesting to see that the expansion in the lab capacity, the expansion in self-sufficiency in oxygen, and self-sufficiency in oxygen in places like Sierra Leone and other places like Somalia that have achieved it, is a massive gain. But it's not just a gain for COVID. It's a gain for kids who will be suffering pneumonia, for pregnant women and eclampsia. It'll be a gain for so many other things. So the tragedy of losing that capability won't just be for the next COVID or the next flu. It'll be for next week, next year, next decade, for the losses we'll suffer in other areas. So I think if we do, and we need people out there, and this is my ask for the day, is we need you out there as citizens, as civil society, to be asking those questions from us, from political leaders. So how are you going to continue the momentum? How are you going to make sure that this is not going to be as bad the next time? What are the agreements that are being put in place to make sure that's not going to happen? What financing has been put in place to make sure it's going to be better the next time? To make sure we won't forget post-COVID condition, to make sure we won't do better the next time. And I think we need, I've said it here many times, we need citizen activists. It is society that will define what those agreements are. Society will define what gets financed. Society should define what's the priority. And if people out there believe that getting better prepared for the next pandemic, ensuring we don't forget the lessons of COVID, ensuring we don't forget people with post-COVID condition, then we've got to get the agreements and the financing and the priorities right. I'll give you an example. The high-level panel that was convened by the G20 on the Joint Task Force on Finance and Health, they calculated that we needed about $30 billion a year to be able to manage many of these pandemic threats around the world. The gap in that, much of that funding already exists, about 20 billion of it, but there's about a constant $10 billion a year gap in that. And in that gap is where we see all the inequity. That gap is where we see the lack of oxygen, the lack of testing, the lack of clinical care. When I put that in perspective, I think that 10 billion buys you, I think, about 50 meters of an aircraft carrier. 1/3, 1/4 of one aircraft carrier. That's what it costs to fix this problem. So the question is, for me, is what are our priorities on this planet right now? We're facing massive climate threat. That's driving a huge destabilization of our ecosystem, pushing migration. Conflict is doing the same. Nature is very discombobulated, very disturbed right now, very, very fragile. And if we look at all those, what are our priorities? Really, I've said it before, a tiny little virus invaded every single country on the planet. It invaded every household on the planet, and it affected every family on the planet. Are we prepared to make the investment that we don't have to suffer that again, when that investment is tiny? That investment is tiny. It is a rounding error in military spending. It is a rounding error when it comes to financial and economic planning at global or even at national level. And that's what sometimes I get disillusioned, because I think this is one of the problems we can actually solve. This is one of them. We can solve this problem. There are a lot of other problems that it's going to be very hard to solve. But we can solve this problem. We have the technology, we have the partnerships, we have the ingenuity, and we have the means to do it. But I don't think we still have the will. I really hope when our member states come together over the next year to agree the pandemic accord, we have a high-level meeting coming up at the UN General Assembly in September to discuss pandemic preparedness and response. There's a whole series of political events happening. The G7 is looking at this, the G20 is looking at this, the ASEAN is looking at this. Everybody's looking at the future. And there is a little fear, going back to the original question, that we could lose momentum now because, in a sense, the emergency is over. We're saying the emergency is over because there's so much else to do. There's so much we need to do now that's more sustainable, not just acute, not just Band-Aids. We have to stop putting Band-Aids on the wounds, and we've got to start to do rehabilitation. We've got to bring our society back, bring our health systems back stronger, bring our health systems back to be more scalable and more responsive to people's needs, and to be more ready for the next threat we face. We can't lurch into the next pandemic in the same situation we are now. So at some point you have to end the emergency to begin preparing for the next one we face. So sorry for going on a bit, but I think it's a really important point, because I really feel for the person who asked the question, because there's always that fear that when we see the same in humanitarian response, Alex. I've seen it in Pakistan, I've seen it in Syria, see it in Libya and Yemen. The world, or Ukraine, the world reacts to the images. We react to the buildings coming down. We react to the hungry faces, and then the world moves on to the next acute thing, right? And it forgets the Yemens, and it forgets the Afghanistans, and it forgets the floods, and it forgets the earthquake-affected victims. And then it's hard to raise money for rehabilitation. It's hard to raise money for rebuilding. It is part of the human condition. We move on. What we're trying to do here is move on but not forget. Move on but learn the lessons. Move on but use COVID as the means to build a stronger system. I hope it works out, but we need political leadership to make that happen.
Thank you very much, Mike. I think with this message, we're coming to close of this conversation. But I just want to tell you that we got a question back. What is the WHO going to do to ensure that the message heard today, that this isn't over, and that it's just the beginning, and that countries need to redouble their efforts?
Well, we're here on a Saturday.
Someone
Few
commented
hours
on
out
that and actually appreciated the commitment.
Well, we don't get many days off, but we're here. I'm going to some stakeholder meetings on Monday and Tuesday in New York with member states to talk about this as well. Dr. Tedros is involved in so many different events, so is Maria, so many others. So we're not going to forget. There's a lot that needs to be done. But it's also, I'll put it back to you all out there. Institutions and governments and politicians and everybody else react to the people. We hope they do, to the will of the people. So I think people have got to set the priorities too. Yeah. People have got to be out there. You're all citizen journalists, you're all citizen activists, you're all on social media. Start the conversation, amplify the conversation, influence the influencers. Do all the stuff that I don't even understand anymore, Alex, but you have the power. You're in control of the narrative. You set the narrative. You drive the narrative. And political leaders now don't look at things I write. They look what's on Twitter. They look what's trending on social media or Instagram. That's what they look at. That's what everyone looks to now. So we need everyone out there to take ownership of the problem and drive this agenda, drive the conversation. Don't let the conversation end. And just say, no, we will not stop this conversation. We will continue discussing this, calling this out until somebody does something to make this sustainable and to make this ready for the future.
I mean, for me, it's been a really emotional couple of days because of that specific question of what does this actually mean? This celebratory moment also scares me. Mm-hmm. And I think when I knew that this was going to happen, or knew that it might go in this direction, I went to my office and I had a good cry by myself, because I was just so fearful about the loss of momentum, the loss of attention. And I can't stop thinking about the people who are dying, the people who are suffering from post-COVID-19, the people who have lost loved ones, who have just started to grieve, who will benefit from medical oxygen in countries for COVID, but for other diseases as well. And it scares me. But I am also incredibly hopeful that there are more people out there that have gone through this collective trauma that we have to keep that momentum going. And I ask myself, and I'm asking everyone I can, these 4 questions. Do you remember? Do you remember the early days of this pandemic? Do you remember when we knew so little? We were grasping at any information that we could. We here at WHO were making the best decisions that we could with the limited information that we had, asking for more information, putting out guidance, screaming at the top of our own lungs with the amplification we could, with the alarms we could raise. What will you do different? What will I do different? What will you do different? And whatever role you have, whichever role you have on this planet, what will you do different the next time? How will your work contribute for the positive? How will your work contribute in whatever field you're in, whether it's science, public health, academia, tourism, sports, music industry, art, anything, what will you do different, and how will it how will it contribute, and what can you do better? So I ask myself that every single day. Everyone asks us, what do you think retrospectively? What do you regret? What are your biggest mistakes? You can look back with 2020 and you can look back and think, and we are a learning organization and we think about this every day. But I also think, what can I do today? And that's what gets me out of bed. So in my good little cry the other day, I thought, pick yourself back up, put yourself back together, and get back to work. Because we work with incredible people around the world. And the DG specifically thanked all of them yesterday. Thanked the frontline workers, thanked the essential workers, thanked the laboratorians, thanked the people who are on farms and putting groceries in grocery stores, driving trucks, on ships, everyone who worked to keep the world moving during this and got back to work. We're back at work. It's a celebratory moment. It's a moment to have a good cry, but it's a moment to get back at it. So we will not forget. We will not forget what needs to be done. We will not forget anyone that is out there that has suffered, that is currently suffered, that will suffer. And we will do everything that we can to prevent that from happening.
Thank you to both of you. Reflecting on all the health workers, frontline workers, and our colleagues in the field and some other crisis. Mike, I think today is 3 months since the earthquake that hit Turkey and Syria, and we've been there and with our colleagues as well. So just that we remind ourselves of all the other crises and all the other efforts. But I also want to say that you are influencers. Maybe, Mike, you're not on social media feed on your phone, but there are people on Saturday listening to you. So you are an influencer. But I want to thank everyone really watching us, not just today, but in past years, and who will continue to follow us and follow our advice. Thanks for watching us today from the UK, Pakistan, Nigeria, the US, Turkey, India, Kenya, Australia, Senegal, Kazakhstan, France, Cameroon, Uganda, Ethiopia, Mali, Brazil, Indonesia, Burundi, Maldives, Argentina, Somalia, Ivory Coast, Syria, Qatar, Ghana, Algeria, South Africa, Trinidad and Tobago, Sri Lanka, Egypt, Uruguay, Zimbabwe, Angola, Togo, Malawi, Bangladesh, Canada, San Marino, Zambia, Germany, Japan, Jordan, Nepal, Sweden, Namibia, Thailand. I think I listed all of them that my colleagues have sent. So the list is long as usual. So I thank to really all our viewers. And as Mike and Maria said, we will continue the work. We'll continue providing you with updates and advice. And just before I close, I do want to thank all colleagues who have helped us today on a Saturday, but also in all previous session. Chris and Mark in the studio. Cole, who have been with us, asking us years ago, when are you guys going to end this? Also to my social media colleagues, always sending me questions. Sari, Giselle, Walter, Yana Vedia. So thanks for all the great teamwork. This is not the end. We'll be back. But in this celebratory moment, it's important as well to appreciate all the colleagues. So thank you so much and have a good weekend.